I just gave up my health insurance, and it wasn't because I can't afford it. It's because it's stupid.
Every time I tell somebody that I don't have health insurance, I get this reaction. What do you do? What are you going to do?
We pay $1,800 a month for a family of 4 to have health insurance.
We haven't had insurance in 10 years, and 2 years ago, I broke my foot.
So we really got to start asking questions about healthcare. I mean, there are many people out there in today's age that said, I'm not paying for healthcare. I don't know what you want me to do. I can't pay for it. And many people are still working to pay for healthcare. There's many elderly out there or retirement age say, I can't afford to retire because I have no health insurance. So they continue to work because of health insurance. And I feel like the idea of health insurance has really shackled people to the workforce, otherwise be getting out. So there's lots of videos out there. Let's take a look at it and let's talk about it. Let's just have a talk about healthcare because this stuff's wild.
Every time I tell somebody that I don't have health insurance, I get this reaction. What do you do? What are you going to do? I go to the doctor if I need to and I pay out of pocket. It would cost me $1,200 a month out of my paycheck to put my family of 5 on a health insurance plan through my job. And as somebody who's not very sickly and doesn't have a very sickly family, I really just can't imagine giving $1,200 a month to an insurance company who's going to turn around and tell me what they are and are not going to pay for. And then they're still going to make me pay a copay when I go to the doctor's office. And by the way, the copays that y'all pay is pretty much what I pay cash out of pocket when I go. So I have this grand idea that if we all did not sign up for insurance and instead take that money that you would spend to your insurance company every month and put it into a savings account that is strictly just for your medical things, then you get to decide what you pay for medically, and you don't have somebody else telling you who has your money that you paid saying, oh, we're not going to pay for that. We don't think it's necessary. I know that may not be ideal for everybody and everybody's situation, and there are situations where insurance is a good thing and it really does help, especially state-funded insurances for people that are in, tragic situations or need like a lot of long-term care, or families with special needs, children, and I get that. So I know it's not for everybody, but also everybody doesn't necessarily need insurance. In my opinion, I'm fine. And if something bad happens and I get into a car wreck, they're not going to take me up in there and be like, well, I see you got 2 broken legs and you're bleeding from your right lung, but we got to send this one home because she don't have health insurance. Guess what? They're still going to treat me. And then I'm just going to pay, the minimum monthly payment on my bill if I need to do that until I get it paid off. Or, maybe I'll save up what I would pay to my insurance company and I'll pay it towards that hospital bill. I mean, that's what makes the most sense to me if you really think about it. Why would I pay an insurance company $1,200 a month and then I'm still going to have to go to the hospital and they're going to overcharge my insurance company, but then I'm going to also have to come out of pocket, I don't know, maybe another $1,200 to the hospital, and it's a scam, guys. It just doesn't make any sense to me, and that's how I choose to live my life. Don't judge me for that.
What do you think about this? Comments down below. We got to learn in the comments dialogue here. I don't agree with her, okay? One of the number one statistical ways of going bankrupt is not having health insurance. And I know you can say that when you're pretty healthy, but there's always that one thing. Like when my dad, especially the elderly, when my dad got sick, he fell, went to the hospital. 2 weeks later, got a hospital bill for about $200,000. Health insurance picked it up, but without that, I don't know what we would have done. And in many cases, I have seen health insurance line item stuff and say, you got to bring this bill down. That's too much. Like the other day, I cut my hand. I cut the tendon on my pinky by accident. And I was like, you know what? That's going to be $2,000 to go to the hospital. Not doing it. Taped it up, put a bunch of Neosporin on it, and it healed. It's doing funky things, but I'm not competing at anything. I don't think that you can look at health insurance like that. As a young person, maybe. But you're one episode away of being bankrupt. And I was Googling, is medical debt bankruptable? And, some parts it is. See a lawyer. But there are many ways that this could hurt you. Jax went to the emergency room the other day. $3,000 for an EKG. Let's get to this next video.
We pay $1,800 a month for a family of 4 to have health insurance. My daughter was recently diagnosed with diabetes, and they are charging us $4,000 on top of our monthly premium. They are charging us $4,000 for the services that she had to literally save her life. On top of that, they would not cover her insulin pen that she needs. She gets half doses of insulin based on her carbs, and for some reason they didn't cover that. Why the fuck am I paying you $2,000 a month if you're not going to even cover what she needs? So it's really hard for me to feel sorry for the CEO of United Healthcare, honestly, or his family, knowing that they have screwed people out of literally their lives. They have not covered things that are medically necessary, life-saving measures to keep people alive. It's not like people ask for diabetes. It's not like people ask for cancer. These are things that just happen, and you shouldn't have to die because you can't fucking afford it.
You know, there's a lot of questions we get asked in this country. Every time there's a war, politicians get on board, throw money into the wind, and here we are. We're shooting rockets back somewhere. But when it comes to things like healthcare, they have yet to sit down and figure out the problem. But yet our taxes keep going up, and they keep inflating the dollar at staggering amounts. But yet children, families can't afford to have healthcare. There's a real question I have here. This is not political left or right. This is just math. I don't understand why it's such a big mess. But I can see this, that since politicians have different healthcare from all the rest of everybody else, they will never solve this question. There are topics in America that they will not touch because they do not want their name associated with that vote, whether they know it should be right or not. There are a handful of problems they could solve tomorrow in a congressional setting, but they will not tackle it. And I'll say this, all the ones paying out of pocket, and they do have an episode, and let's say they do discharge it, those are the ones that put hospitals under. If everybody just went to the emergency room and said, oh, you know, $20,000 not paying it, some of these hospitals have very low margins, especially the ones that are community owned, like here in town. I'm not going to name the name of it, but they have low margins, and they only have certain things that are cash producers for the hospital. But we all want world-class healthcare. Somehow you got to pay for it. And the problem is between the insurance companies, the doggone politicians, and then somebody trying to make a dollar. In there's got to be a way we can work this out. If we'll stop focusing on wars in foreign countries and here in America, we could solve this problem. Or just lower taxes and let us pay it out of our own pocket. But if you keep raising taxes, you better start paying for it.
We haven't had insurance in 10 years, and 2 years ago I broke my foot. And obviously I was like very concerned about what that would look like, because when you don't have insurance, the last thing you need to do is end up in an emergency room. But what I did when I first moved to this area was I called around all the emergency rooms and urgent cares to find out what their caps were. So I asked them like, hey, do you have a cap on services? What's the minimum that your services start at? So because I did that, I knew which emergency room to go to. So I went to that emergency room. I had x-rays done. I got IV fluids. I got pain medication. I got x-rays, which I think I already said that. And I got a full blood panel. And I was there probably about 4.5 hours. Do you know what my bill was when I left that hospital room? Because they have a cap. $630.
I want to know what emergency room she went to, okay? And when I break something, I ain't Googling, you know, who's the cheapest. I'm Googling who will get me in because the line's not 5 hours long. I don't know how an emergency room can break even on that. And if everybody did that, that hospital would be bankrupt. You know what the hourly is for a nurse? Do you know what the cost of the medicine, the cost of the x-ray, the cost of all these things? You know how much the bulb on an x-ray machine costs? I don't know how you could do this. I get what she's doing. I get what she's saying. We have a healthcare problem. But financially, a hospital can't do that. I don't know how the bill was that much. Comment down below if you know more about this than I do. We need to talk about it.
I did not get a secondary bill at my house because I don't have insurance. I paid cash. And I walked out of there with a $630 bill for an emergency room. Then I was referred from them to a specialist who was going to cast my foot. And I was casted. So I saw the specialist. I went back in to be casted. I broke my cast and had it recasted. And then I had my final visit with him where he removed the cast. So in total, everything that I paid, including the emergency room, was $1,500. I paid $1,500 for a broken foot with x-rays, a specialist, being seen 2 more times at that specialist, plus having it removed. I paid in total $1,500. I think it was like $1,530 something. And I never got a bill again from anybody. And that was also medications. Don't feel pressured into getting insurance. I cannot even begin to explain to you how much easier it is to navigate without insurance.
I've got some doctor friends that really want cash patients. I've got some doctor friends, especially dentists, want just cash. And I know the last dentist I went to didn't want to take my insurance. They wanted cash payments. Like I see it, but I don't know how an hourly for a specialist, hourly for a doctor, hourly for the nurse, hourly to run the entire facility. I don't know how you make money like that. I don't know how they stay operating. Comment down below if you can think of it or have an idea. This next guy, he's got some interesting ideas too, and he kind of went through the same scenario.
I just gave up my health insurance, and it wasn't because I can't afford it. It's because it's stupid. I found a place in town that'll do direct care. They're a direct care provider. So what that means is you pay them a monthly fee, and then you can use all the services they offer. So in this case, it's almost everything. Like even a lot of medications are covered by a $50 a month membership. Doctor visits are free. The only thing I've had to pay for so far is labs that with my insurance would have cost me $200. And with this doctor, it was $100. I've looked into it for so long now. I have so many examples, but one is I saw this lady on TikTok that got a shot that was $10,000. Something, hormone therapy or something. So just for fun, I asked my doctor, I was like, I don't actually want it. I just want to see what price you can get for this medication, this shot, $500. I have a lot of comparisons like that. I just gave up my health insurance, and it wasn't because I can't afford it. It's because it's stupid. I found a place in town that'll do direct care. They're a direct care provider. So what that means is you pay them a monthly fee, and then you can use all the services they offer. So in this case, it's almost everything. Like even a lot of medications are covered by a $50 a month membership. Doctor visits are free. The only thing I've had to pay for so far is labs that with my insurance would have cost me $200. And with this doctor, it was $100. I've looked into it for so long now. I have so many examples, but one is I saw this lady on TikTok that got a shot that was $10,000. Something, hormone therapy or something. So just for fun, I asked my doctor, I was like, I don't actually want it. I just want to see what price you can get for this medication, this shot, $500. I have a lot of comparisons like that.
I think this could work in triage, like some very basic type medical situations. And I've said for a long time, you might hate me for this, but I'll say it because nobody else will. There are many types of medicine that you don't need a humongous effort to fix. Things like outpatient care, like clean your ears out, minor stitches, sprains, bumps, bruises, things that don't require any type of x-rays, MRIs, things that are really expensive, things that a nurse could do. And I feel like in this country, we've over-educated and over-licensed a lot of things. Many things a nurse can fix. Like, I know many competent nurses, PAs, that can do a lot of things. And you only really need a doctor for things that are on the top level of things. Internal medicine, administering certain types of pharmaceuticals, things that an actual doctor needs to look at. Gotta ask this question, and I think a lot of this has to do with litigation protection. We overeducate, over-license everything to say, you know what, a doctor saw it, instead of saying, that nurse is perfectly capable of doing those 3 stitches or this small medicine that might fix the problem. And we can all say, hey, self-treatment, self-care, those same products could be issued by a nurse. And I don't think many a times it needs to be seen by a doctor. And this would keep the cost of a lot of things down, and it would keep the burden down on a lot of things. We got to ask these questions because we got to bring the cost of healthcare down and more accessible to most people. And many of these things can be done. In the Army, a medic could fix a lot of things, and she could issue certain types of medications right there on the spot in her little pouch. She didn't need to be a doctor to do 90% of the things that combat medic could do. When we had Little Jack told the story 5 or 6 times on other videos, but the medical bill was astronomical to have a baby. $40,000. And I wonder what the cash equivalent would have been. But also I know health insurance paid for it all, and I don't know what we would have done, because you're just one mess up away, or one problem, complication away from humongous bill. You know, I've heard of premature babies being in the hundreds of thousands of dollars to $1 million, depending on how long they've got to be in there. I've got a friend, and her 5-year-old had cancer, and they had to go spend many days at a specialist way away from where they lived, and they had to pay for hotel rooms, they had to pay for cancer treatment, they had to pay for all types of things. You just never know, and that's what you're paying to insure it. I cannot get around the idea of not having health. When you're looking at the risk analysis on it, the downside is too big. It seems like we've built this system that forces everybody to stay in the system because it's so expensive outside the system that nobody can afford it. The rich, they can afford anything. The poor, they rely on the government, and those in the middle, those middle to lower middle class people are stuck in the system. They have to sacrifice most of their paycheck for healthcare, knowing that healthcare is so expensive. And I don't know what the answer is. And politicians seem like they're not willing to go down this rabbit hole. And elder care is something nobody wants to talk about, and it is one of the ones that touches people the most when their parents get old. That one little thing, or a nursing home bill, can financially break you. I want to know your comments down below. Don't forget to like and subscribe. I don't know which topic I'm going to pick next, but I think these are interesting. I like going down these rabbit holes because there are things that eyeballs need to see to fix these problems and hold politicians accountable. Let's get to the next one.